What if your blemishes could talk? Could they expose internal health problems? A widely circulating internet post says yes. Where you break out can reveal what is wrong with you. So we're asking, can I call you Dr. Pimple Popper?
Yes, you
Is that okay?
Yep.
Dr. Sandra Lee, what is the real deal?
Yes. Well, there is this claim that according to the area of your breakout, your acne breakout, it's a reflection of your lifestyle. For example, they say that if you break out on your forehead, it's due to a poor diet, irregular sleep, digestive problems. On your nose, you have poor blood circulation. On your cheeks, it's due to stress and allergies. And on your chin, it's because you may have a kidney imbalance and hormonal imbalance. And all of these...
So what's the real deal?
I'm here to tell you that this is ridiculous and it's all false. So, it all has more to do with your hormones, your genes, your genetics, and your your skin type.
So let's go through some areas, some problem areas we've all had.
So actually, what's really nice, though, this gives you a little bit of a lesson, too, as a dermatologist, because we know, according to the area in which you break out, it does really kind of give us a clue as to what is causing your breakout.
Okay.
So, for example, if somebody gets a breakout on their forehead, we suspect something called pomade acne. That is when people wear a heavy product in their hair, like something that's oily or greasy, and they might wear their bangs across their face. That's the first thing I look at when someone breaks out a lot on the forehead. And here's an example of somebody on the forehead. And here on the nose, now in particular, if we see something there, I'm going to ask about whether there's certain activities that tend to trigger your breakout, like whether it happens after you drink coffee, if you're drinking alcohol, if you had just exercise, chocolate, spicy foods, all kind of the fun stuff, but all those kinds of things make us think about rosacea. And now for your cheeks. It's pretty common to get a breakout in our cheeks, and I will say that in males, if we see an abrupt breakout, we're gonna think about steroid acne. So if somebody's a little bit pumped up, and it comes up really abruptly, if you have a breakout, I'm gonna think, is this person taking anabolic steroids?
For the record, it doesn't mean someone is.
No,
so
it doesn't, but it's just
you
something
go
to
home
think
tonight to your
about.
spouse, it's like, honey, are you juicing?
No. Just something that we think about. And if you're a female and you get a breakout and you're an adult and you get a breakout in the beard distribution or the mandible distribution, that's actually something that we suspect might be a hormonal imbalance. And certainly if you have hirsutism, meaning you have some terminal hair growth, or your voice is a little deeper or something, maybe there's something a little awry with your hormones, and we might even suspect or evaluate for PCOS, polycystic ovarian syndrome, or something that might cause this breakout, because if you can solve that, we can maybe solve their acne. We could probably solve their acne.
And so that is an example of where your acne may reflect something going on internally.
Yes, absolutely. And on your chin, a lot of athletes will get an acne breakout on their chin because they wear a chin strap. Water polo players, football players, wrestlers, and they don't realize that this occludes this area. You sweat in that area. It's dirty, too. And also in that area, you get perioral dermatitis. So perioral dermatitis actually happens exclusively, well, almost exclusively in women, and it's actually not acne. It may look like it, but it's actually a little eczema or a little breakout. So these are the kinds of, if I see these in these areas, the breakout in these areas, I'm going to think of a specific diagnosis or kind of hone in on some kind of treatment regimen because of it.
So it's like anything in medicine. If you keep track of where your problem areas are, you can discuss that with your doctor, and maybe there will be a clue in that helps you determine what the true cause is. That is the real deal.